Hi, I'm Dr. Rajani. Today we're talking about Kybella and the number one pitfall, not using enough product. So I did a video prior on Kybella and the 5 pitfalls. You might want to watch that one first, but the number one pitfall was not using enough product. So patients aren't getting a high enough dose and they're not coming back for enough treatments. I wanted to expand on that today. People love before and afters, so we're going to show before and after treatments, and on each one, I'm going to go through what was done, how much product was used, how many sessions they had, and remember, before and afters are tough for clinics. There's Instagram, there's social media, we're all showing the best results we ever had. So expectations set by before and afters are complicated, and when you see them, it doesn't mean that that's the result that you're actually going to get. It's an example of a result. We're all different. The consult is most important, and tissue and skin and necks, despite what people may think, all have their different anatomical variations and the body's response. Let's go and look at 3 before and after pictures, and I'll take you through what was done. So here in this patient, this would be a typical patient that presents to a clinic, and you can see this is the front picture. You can see from the far left, the before, to the far right, the after. There's some nice tightening, there's less submental fat, not a dramatic difference if you look at the front picture. Now the patient will likely notice and tell you there's a dramatic picture. Let's go and look at the side profile of this patient. So here if we look at the side profile, and this is why it's so important to get pictures before and after, and then the side view, the 45 degree, and the front on view. On the side view, we can see a dramatic results, but let's see what was done here. Now there's a total of 4 treatment sessions with 15.2 mLs. Divide that by 2 to give you the number of vials that you would need, and it's just over 7 vials of Kybella. So you can see over 4 treatment sessions how much we used and how often the patient needed to come back, but look at that great permanent result if you follow a treatment protocol with enough product. Let's look at another patient now. So here's a male patient, and we're looking at the side view, the before and the after, and this was a total of 4 treatments. A total of 19 mLs, or just about 10 vials, were used over these treatment sessions. On the side view, you see an excellent result. You can see in the after picture, would the patient possibly want more? Of course. Despite having a great result, you can see people want an amazing result. So while the results show for themselves, it shows that this patient could easily go on for a 5th and 6th treatment. And in the consult for these patients, we need to tell them and actually show them these pictures so they realize how many times they're coming back and that they might want further treatments to tune up their result. But again, 19 mLs, it's not one kit. If you treat this patient with one treatment, there may be almost no results visible on pictures. Even though the patient can sometimes be happy, you're not going to get a nice enough dramatic result to really wow patients. We always want to wow our patients. So here's a frontal view. On the before to the after, you can clearly see less submental fat. There's a nice contoured jawline in the after picture, but let's look what was done here. The patient had a total of 6 treatment sessions, and this was common in the trial. The total mLs used were 23, or about 11 to 12 vials of product were used. That's about 3 total kits over the 6 treatment sessions. Now the patient still might want further contouring. However, it's a great result. The patient did come back several times and there was nice tightening. So we have to really gear our patients up for what it takes to go through the Kybella treatment process. They can get a great result with a few treatments, but certainly going towards 4 to 6 treatments, as you can see, is not uncommon. So I hope that helps. I wanted to further address, I got a lot of questions on what the number one pitfall was and what do we do about it. Of course, cost comes into play. We'll cover that in another video, but it varies across the country. Some people now are charging an injection fee and then using however many vials they need for a set price. Some people do it per vial per kit, but the worst thing we can do is sell one treatment session. And remember, the most expensive thing for our patients is to go from one place to the next for the deal of the day, because there's no data on what they did, what they needed to do, and what they think is cheap ends up becoming much more expensive, and we have unhappy patients. So it's important to cover that in the consult. Thanks for joining me today. Join us on this YouTube channel, on Facebook and Instagram for continued helpful tips. Keep your skin and body beautiful, healthy, and vibrant.